Okay, so coming back to my point earlier on about social determinants of health, I'm wondering for the Zimbabwean population where you've got an issue with HIV/AIDS, what COVID means to that population of society? Because again, you've got people who perhaps are a little bit reticent to go and seek help.
Yeah.
They're kind of trying to self-manage. If they have symptoms, maybe even afraid to go and seek professional support. What is your take on a combination of antiretrovirals and then just thinking beyond that to just managing HIV and AIDS, to managing the prospect of COVID and everything that goes with it?
For care, it is important that people who have got HIV and on antiretrovirals to continue taking their medicines. I think there are a lot of things that people have done, I think, to manage flu remedies that are home remedies. I remember when I was growing up, I would drink, I think it's a guava. I can't remember what my grandmother would used to give me, but I think it's guava leaves or something to manage the flu. But generally, most flus recover even without any medicine. So the usual taking of fluids is very important. Boosting your vitamin C is very important. So those are things that people need to take cognizance of. And obviously, if you've got a fever, the taking of paracetamol or antipyretics is also important so as to lower the fever. But to take antiretrovirals without prescriptions is not the way to go. So I know people would want to self-medicate, and at some point in Harare, we had, I think, chloroquine running out because people had heard that chloroquine is medicine that can be used to treat COVID-19. So those things I think people should not do because all drugs have got side effects, and if they're not prescribed by medical practitioners after thorough assessment, then they may have dire consequences than what the COVID-19 would do.